Hello, my name is Jennifer Zeng. From today on, I'll be doing a YouTube show called Inconvenient Truths by Jennifer Zeng. I wish to share some of the true facts about China and the world, as well as some of my insights. During the current coronavirus pandemic, we learned, perhaps in a very bitter way, how our future and our fate depend on our current actions and decisions, and how important it is for us to have true, correct information to make correct decisions. So, to put it another way, whether we have true information or not will decide our fate and our future, both for our nations and for ourselves. We all know that COVID-19, as well as the pandemic, started in Wuhan, China. As a Chinese who once lived in China for 35 years, I have the advantage of knowing the country, the language, the people, and the culture. I once worked for the Development Research Center of the State Council of People's Republic of China. It is the highest level government policy research and consultant body. So you can consider me as a China insider. So, as a China insider, I have the advantage of being able to make sense and judgment of information about China or coming out of China. So I'm hoping that I can bring forth some valuable and useful information and insights about China to the world. I do believe true information can save lives. That is the reason why I started this program. I hope you find it useful and helpful. The first program I do will be about the timeline of the most important issue that is affecting us all, the coronavirus pandemic, and the cover-up history of the Chinese Communist regime, or the Chinese Communist Party, the CCP. While the CCP is trying to rewrite the history, we must straighten out the record first. It is not only helpful for our current battle against the most damaging disaster, but also needed now and in the near future when mankind tries to hold the CCP responsible for this disaster it imposed on mankind. Now, let's get started. According to the current information we have now, the first confirmed case of the coronavirus, or let's call it the CCP virus in the future, because this name holds the CCP accountable for the suffering and tragedy we are having now. So according to a report by South China Morning Post, the first CCP virus case was confirmed on November 17th of last year. Then on December 1st of last year, according to a study in The Lancet, the symptom onset date of the first patient identified was December 1st, 2019. This patient had a history of exposure to Huanan or South China seafood market, which was identified as a point of origin for the CCP virus pandemic. The recent study continues to say that 5 days after illness onset, the first patient's wife, who had no known history to the exposure of the market, also presented with pneumonia and was hospitalized in the isolation ward. In other words, as early as the second week of December, Wuhan doctors were finding cases that indicated the virus was spreading from one human being to another. On December 15th, according to an already deleted exclusive Chinese language investigation conducted by a Chinese media outlet called Caixin, a 65-year-old male delivery man in the South China seafood market started having a fever. 3 days later, he went to the emergency department of the Wuhan Central Hospital to see a doctor. This is consistent with Dr. Ai Fen's account. Dr. Ai Fen is the director of the emergency department of Wuhan Central Hospital. She says that as early as December 16th, one patient was having a high fever for unknown reasons, went to the emergency department to seek treatment. Then, on December 21st, Wuhan doctors began to notice a cluster of pneumonia cases with an unknown cause. And then, according to the Chinese media Caixin, Professor Zhao Su, the chief physician of the Department of Respiratory Medicine of Wuhan Central Hospital, a sample of one of the patients was sent to a third-party testing agency called Guangzhou Weiyuan Gene Technology Company to conduct a gene test. On December 25, 2019, according to Dr. Lü Xiaohong, she is the director of Digestive System Diseases Department of No. 5 Hospital in Wuhan. Medical staff in 2 hospitals in Wuhan are suspected of contracting viral pneumonia and are quarantined. This is additional strong evidence of human-to-human transmission. On December 26, 2019, according to Dr. Zhang Jixian, she is the director of the Department of Respiratory and Critical Care Medicine, Xinhua Hospital of Hubei Province. On that single day alone, she herself had seen 4 patients with pneumonia of unknown cause in a row. December 27th of 2019 is a very important date. On that day, Dr. Zhang Jixian reported to the hospital and Hanjiang CDC in Wuhan that 4 patients with viral pneumonia of unknown causes were found. On December 28th to 29th, 3 similar patients were admitted to Xinhua Hospital. They all had similar symptoms of viral pneumonia. Xia Wenguang, the deputy director of Xinhua Hospital, called an expert meeting, and all experts agreed the patient's symptoms were very unusual. Xia Wenguang directly reported it to the health commissions of Wuhan City and Hebei Province, as well as the Public Health Department of Wuhan Central Hospital. In the same afternoon, the health commissions of Wuhan City and Hubei Province notified all the CDCs at the provincial, city, and district levels. On December 27th, Weiyuan Gene Technology Company's result came out. They notified the hospital over the phone that it was a novel coronavirus. Professor Zhao Su said at that stage, the patient had already been transferred to Wuhan Tongji Hospital. The result of the test was later published at the English version of the Chinese Journal of Medical Sciences on January 27th. With the title of Identifying a Novel Coronavirus That Causes Severe Pneumonia in Humans. Another source published by WeChat account Wenya on January 28th discussed the same discovery in an article entitled A Record of Discovering the Novel Coronavirus First. The author said he worked in a private lab located in Guangzhou City in Guangdong Province. On December 27th, their lab assembled a nearly complete viral genome sequence, and the data was also shared with the state-affiliated Institute of Pathogens, Chinese Academy of Medical Sciences. Wenya's article says it can basically be confirmed that this patient's sample does indeed contain a new virus similar to bad SARS-like coronavirus. The information obtained at the time was that the patient had returned to his hometown, and we cannot rule out the possibility of his contact with bats. After realizing the severity of the potential risk, the lab was completely cleaned and de-infected. The samples were harmlessly destroyed, and the relevant personnel of the experiment operation were put under relevant monitoring. The doctors had been communicated before noon, and the patient was also quarantined. From this account, one can see that the lab has realized the severity of the problem. As a result, the head of the company communicated in telephone with the hospital on the same day and with Wuhan CDC on the following day, which is December 28th. He even personally went to Wuhan on December 29th and December 30th to communicate in person with the hospital and Wuhan DCD and shared with them analysis results. Wen Yao said in his article he was very nervous when the result came out and showed that this new virus was very similar to banned SARS-like coronavirus. He predicted a grave public health problem on December 27th. He said when he realized that they might have found a new virus, he was both nervous and excited. He was nervous as this new virus could be as terrible as SARS. He was excited as they had identified the pathogen early and had isolated the patient, so it was possible to eliminate the virus before it could spread widely. However, he felt very angry, disappointed, and pained that although they had worked so hard to identify this new virus, the official report said that no human-to-human transmission was found, and then things went totally out of control, and the entire nation got affected. He said what went wrong was not about science or technology, but about the decision made, as well as the role media reports was playing. Also on December 27th, a 41-year-old man named Chen went to the Wuhan Central Hospital for treatment. His sample was sent to another company called Beijing Boao Medical Laboratory to be tested. On December 30th, Wuhan Central Hospital obtained the sample of another 41-year-old patient, whose surname is also Chen. The sample was sent to Shanghai for testing on January 3rd. We will discuss the result later. Also on December 30th, Beijing Boao Medical Laboratory returned the report of the patient's test to the doctor, and the test result was SARS coronavirus. An expert later told Caixin that the result was actually a mistake. He said their gene bank is not complete enough, or it may not have been reviewed, so they made a small mistake. In fact, it is not the same thing as SARS, it is just a new type of coronavirus. However, because of the mistake, the term SARS drew attention of some doctors. On the same day, Dr. Ai Fen shared a report of a contagious SARS-like virus in her department group chat on WeChat. She is later punished by her hospital for spreading rumors. She also spoke to her colleague, Dr. Li Wenliang, who later became the whistleblower of this outbreak. Dr. Li Wenliang was also a member of the Chinese Communist Party. He wrote on social media about 7 people contracting SARS-like virus. He posted an RNA analysis finding which showed SARS coronavirus and extensive bacterial cloning in the patient. Also on December 30th, an urgent notification issued by Wuhan Health Commission was circulated on the internet, saying that pneumonia of unknown cause patients have been found at some medical institutes in this city. The notification also ordered all hospitals to report any related information, but forbidden any institute or individuals from releasing information to the outside. The notification omitted any mention of SARS or coronavirus. On December 31st, 2019, Wuhan Health Commission notified the public for the first time about the pneumonia, saying that 27 cases of viral pneumonia were found in Wuhan, and that the investigation so far has not found any obvious human-to-human transmission, and there was no medical staff infection. This is actually the opposite of the belief of the doctors working on patients in Wuhan, and 2 doctors already were suspected of contracting the virus. On the same day, an expert team was sent to Wuhan from the National Health Commission to guide the epidemic control effort. It is noticeable that while people in Wuhan and most people of the world had no idea whatsoever that a fatal contagious epidemic had already appeared in Wuhan, Taiwan acted first. As a response to the pneumonia epidemic in Wuhan, Taiwan initiated on December 31st a standard disease control measure at its border by screening incoming patients, checking their temperature, travel history, exposure to known cases, etc., in an effort to block the epidemic from entering Taiwan. The development of situations later proves that Taiwan is one of the least hit countries by the CCP virus because it didn't trust the CCP or the World Health Organization (WHO). It relies on its own information and analysis to make decisions. So, as of December 31st, the last day of 2019, at least 9 samples of patients were collected for inspection, and the results had also come out showing a SARS-like novel coronavirus. These test results were reported back to the hospitals and also to the health commissions and the CDC's system. However, no precautions or measures were taken. The Caixin website, in its exclusive investigation, has put it this way. Looking back at the days from the end of December 2019 to the beginning of January this year, we can see now that it should have been a crucial moment in determining the fate of countless people. But at that time, the public was yet to know the consequences this virus would bring to us in the future. Okay, let's take a break for now and continue to discuss what was going to happen in 2020 in our next episode. For watching, and please subscribe to my channel and share it, as true information does save lives at this critical and unprecedented moment in human history. Thank you. See you next time.